The Omicron variant continues to spread throughout Arizona and the nation, making Arizona have one of the highest COVID-19 numbers in the country. Cronkite News reporter John Brown takes a look at COVID-19 in Arizona.
2 years ago today, the state of Arizona confirmed its first recorded COVID-19 case. Now, in year 2, the state is in a battle with the highly contagious Omicron variant.
This is the first time that I've ever seen a new disease enter the pantheon of human diseases that has had such an incredibly profound effect on the health of so many people.
Dr. Joshua LeBaire, Executive Director of ASU Biodesign Institute, says his biggest lesson from the COVID-19 pandemic is that the disease is transmissible, unlike cancer and heart disease. And with its high transmissibility, the Arizona Department of Health Services is recording just over 18,000 new cases today.
We saw the testing hospital peak likely occur in Arizona at the end of last week. We've certainly seen case counts this week decrease week over week.
Valleywise Health's Chief Clinical Officer, Dr. Michael White, encouraged all people to get vaccinated to combat the Omicron variant. White added that the hospital staff are burnt out from the pandemic. And the Arizona Department of Health Services reports today an additional 275 deaths from the COVID-19 virus. In the newsroom, John Brown, Cronkite News.
A new Omicron subvariant, BA.2, dubbed Stealth Omicron, has been detected in over 20 U.S. states, including here in Arizona. Health experts say it's a little too early to decipher whether or not BA.2 will cause more severe symptoms than the more common mutation of Omicron, BA.1. They do say that BA.2 appears to be more transmissible, which they warn will inevitably lead to higher case numbers. The high rate at which BA.2 case numbers are increasing has experts keeping a close watch on the subvariant for the future.
Today, the Occupation Safety and Health Administration retracted the COVID-19 vaccine mandate for businesses with over 100 employees that they implemented just over 2 months ago. The announcement comes after the Supreme Court recently voted 6-3 to block the OSHA vaccine mandate for private businesses. The mandate affected over 80 million American workers. In a statement, OSHA said that they still strongly recommend the vaccination of workers against the continuing dangers posed by COVID-19 in the workplace. As COVID cases continue to rise, parents with children under the age of 5 continue to wait for FDA approval to vaccinate their kids. Dr. Anthony Fauci said today he can't predict when the authorization will come. Fauci says original data from clinical trials showed the dosage for children ages 6 months to 24 months reached the same efficacy levels as adults, but the dosage in children 24 months to 4 years old didn't reach the same level. He says studies will continue, and right now it looks like a 3-dose regimen will be needed for this age range. The companies creating the vaccines are still presenting data to the FDA, and it is important for them to be very careful in their evaluation of the data, given the vulnerability of the children.
When these vaccines become available for children at those age, we can be certain that they will be safe and that they will be effective.
Fauci urges Americans to be patient and take steps right now to protect themselves and their children, such as wearing masks and testing.